If you're a senior and you've ever checked your blood pressure at home and felt your heart drop because the numbers suddenly shot up, this video is for you. I'm Dr. Whitmore, and today we're going to talk calmly, clearly, and honestly about what to do when your blood pressure spikes at home. And most importantly, the 2 things you should do immediately to protect yourself. First, let me say this. A sudden high reading does not automatically mean you're in danger. Blood pressure is dynamic. It changes minute to minute based on stress, movement, pain, temperature, hydration, and even what you were just thinking about. I've seen many seniors panic over one high number, and that panic alone can push the pressure even higher. So before anything else, take a breath with me. You are not powerless here. Blood pressure spikes at home are very common, especially as we age. Stiffer arteries, slower recovery from stress, and medication timing can all play a role. Sometimes the spike happens after climbing stairs, arguing on the phone, watching distressing news, or even rushing to put the cuff on. The key is knowing how to respond in the moment instead of reacting with fear. Here's what worries me the most as a physician. People immediately reaching for extra medication, or worse, ignoring the reading entirely. Both can be dangerous. What you need instead is a simple, repeatable plan. That's what this video is about. Before I tell you the 2 immediate actions, let's clarify what we mean by a spike. If your systolic number suddenly jumps 20, 30, or even 40 points above your usual reading, but you feel otherwise, okay, no chest pain, no severe headache, no shortness of breath, that's usually a stress response, not an emergency. And stress-driven spikes can often be brought down safely at home. The first thing you must understand is this. Your nervous system controls your blood pressure more than you realize. When your body senses threat, real or perceived, it tightens blood vessels and raises pressure to protect you. That response made sense when humans were running from danger. It does not serve you when you're sitting safely in your living room. That's why the first immediate action focuses on calming the nervous system. Not with pills, not with denial, with a very specific physical response that signals safety to your body. When done correctly, it can lower systolic pressure by 10 to 20 points within minutes. I've seen it happen thousands of times. The second immediate action has to do with posture and circulation. Many seniors unknowingly raise their blood pressure simply by how they are sitting, holding their breath, or tensing their muscles during the measurement. A small adjustment here can make a measurable difference very quickly. Now let's go straight into the first thing you should do immediately when your blood pressure spikes at home. This step alone can make a meaningful difference within 5 minutes if you do it correctly. The first action is controlled, slow breathing that activates your parasympathetic nervous system. That's the part of your nervous system responsible for calming your heart rate and relaxing your blood vessels. Most people think breathing is automatic, so it doesn't matter how you do it. That's simply not true. Especially for seniors. When blood pressure spikes, breathing almost always becomes shallow and fast without you realizing it. This sends a danger signal to the brain, which tightens your arteries even more. So our goal is to reverse that signal deliberately. Here's how I want you to do it. Sit comfortably with your back supported. Place both feet flat on the floor. Uncross your legs. Rest your hands loosely on your thighs. Now gently close your mouth and breathe in through your nose for a slow count of 4. 1, 2, 3, 4. Hold that breath softly for a count of 2. Then exhale through your mouth for a slow count of 6. 1, 2, 3. That longer exhale is critical. It tells your vagus nerve, your body's main calming nerve, that you are safe. When the vagus nerve activates, blood vessels begin to relax and pressure starts to come down naturally. Repeat this breathing cycle at least 6 times. That's about 2 minutes. Do not rush it. Do not force the breath. If you feel lightheaded, shorten the count slightly but keep the exhale longer than the inhale. While you're breathing, I want you to drop your shoulders. Seniors often hold tension there without realizing it. Let your jaw loosen. Unclench your teeth. Even small muscle tension can keep blood pressure elevated. I've had patients call me in a panic saying their reading was 180 or higher. After 5 minutes of this exact breathing pattern, they rechecked and saw numbers drop by 15, sometimes 25 points. Not because anything magical happened, because their bodies stopped thinking it was under attack. Now here's something very important. Do not keep checking your blood pressure every minute while doing this. That creates anxiety and interrupts the calming response. Set the cuff aside. Focus only on breathing for a full 5 minutes. This is not ignoring the problem. This is addressing the root cause of most sudden spikes. Nervous system overactivation. If after 5 minutes you still feel calm and stable, then you can recheck your blood pressure once, not twice. Once, and whatever that number is, we respond rationally, not emotionally. One more thing seniors need to hear clearly. This breathing technique is safe even if you are on blood pressure medication. It does not interfere with your treatment. It works alongside it. Now let's talk about the second thing you should do immediately when your blood pressure spikes at home. This step is simple, physical, and often overlooked, but it can have a powerful effect within minutes, especially for seniors. The second action is correcting your body position to optimize circulation and reduce vascular resistance. In plain language, how you sit and hold your body directly affects your blood pressure reading and your actual blood pressure. Here's what I see all the time in my older patients. They feel anxious, they rush to sit down. They perch on the edge of a chair, their feet are dangling or crossed, their back is unsupported, and their arm is held awkwardly in the air while the cuff tightens. That position alone can raise systolic blood pressure by 10 to 15 points, sometimes more. So let's fix that immediately. Sit all the way back in a sturdy chair. Your lower back should be supported. If needed, place a small pillow behind you. Both feet must be flat on the floor, not on tiptoes, not tucked back, not crossed. Crossing your legs compresses blood vessels and increases resistance, which pushes the pressure up. Next, relax your thighs and abdomen. Seniors often tighten these muscles without realizing it, especially when they're nervous. Muscle tension equals higher blood pressure. Now let's talk about your arm. The arm with the blood pressure cuff must be supported at heart level, not below, not above. Rested on a table, armrest, or pillow, so it's completely relaxed. If your arm is hanging down or you're holding it up yourself, your body interprets that effort as stress. Turn your palm upwards slightly. This helps relax the shoulder and upper arm muscles. Again, we're removing signals of strain from the body. Once you're positioned correctly, stay still. No talking, no watching stressful television, no scrolling on your phone. Even listening to upsetting news can raise your pressure while you're trying to bring it down. Now here's something important that many seniors don't realize. Gravity affects blood pooling in the legs as we age. If you've been standing, walking, or doing chores before checking your blood pressure, your circulation needs time to settle. That's why sitting quietly in the correct position for 5 full minutes before rechecking is not optional. It's essential. Combine this posture correction with the slow breathing you learned in the last part. These two actions together work synergistically. Breathing relaxes the nervous system. Posture removes physical barriers to blood flow. I want to be very clear. This is not about cheating and the blood pressure reading. This is about getting an accurate reading and helping your body return to baseline. These steps reflect how blood pressure is meant to be measured medically. After 5 minutes of proper posture and breathing, then, and only then, recheck your blood pressure once. Many seniors are shocked to see how much the numbers come down when they stop fighting their own bodies. If your numbers are still elevated but lower than before, that's progress. If they're close to your usual range, that's reassurance. If they remain very high, we talk about next steps calmly and logically, not with fear. Now, let's talk about something every senior needs to understand clearly. When a blood pressure spike can be managed safely at home, and when it signals that you need medical help, right? Away, knowing the difference removes fear and replaces it with confidence. First, let me say this plainly. Numbers alone do not determine an emergency. Symptoms do. I've treated patients with very high readings who were stable, and others with lower numbers who needed urgent care. Your body always tells the fuller story. The blood pressure spike is generally safe to manage at home if you feel otherwise okay. That means no chest pain, no pressure or tightness in the chest, no sudden shortness of breath, no new confusion, no weakness on one side of the body, no difficulty speaking, and no severe headache that feels different from anything you've had before. If your blood pressure is high, but you are calm, breathing normally, thinking clearly, and your symptoms are absent or mild, then the two actions you've already learned, controlled breathing and proper posture, are exactly what you should be doing. Now let's talk numbers briefly. Without panic, if your systolic blood pressure is above 180 or your diastolic is above 120, but you feel fine, this is called a hypertensive urgency, not an emergency. It still matters, but it does not mean you need to rush to the hospital in a panic. The goal is gradual reduction, not sudden drops. This is where many seniors make a dangerous mistake, taking extra medication without medical guidance. Doubling up or taking an additional dose can cause blood pressure to crash later, leading to dizziness, falls, or even fainting. Please hear me clearly. Never take extra blood pressure medication unless your doctor has specifically instructed you to do so in advance. If your blood pressure remains very high after 20 to 30 minutes of calm breathing and correct posture, the next step is to call your doctor's office or an on-call nurse line. They can guide you safely. That is a smart, responsible action, not a failure. Now let's talk about when you should not wait. Call emergency services immediately if a blood pressure spike is accompanied by chest pain, jaw pain, arm pain, sudden shortness of breath, vision changes, slurred speech, confusion, severe dizziness, or weakness or numbness on one side of the body. Those are warning signs of a heart attack or stroke. And time matters. Also, if you feel an intense sense of doom, crushing pressure, or something feels profoundly wrong, trust that instinct. Seniors sometimes downplay symptoms, but your intuition is important. Here's another point I want to emphasize. Rechecking your blood pressure over and over during a spike feeds anxiety and keeps the numbers high. After your initial recheck, put the cuff away. Focus on staying calm. Let your body stabilize. Blood pressure control is not about winning a battle against your body. It's about working with it. And when you respond calmly, your body almost always responds in kind. Now let's talk about what to do after the blood pressure spike has passed, because this is where long-term control is built. Seniors who handle this part well tend to experience fewer and less intense spikes over time. First, write the episode down. I know this sounds simple, but it's incredibly powerful. Note the time of day, the blood pressure reading, what you were doing beforehand, how you felt emotionally, and how long it took for your pressure to come down. Patterns emerge quickly when you do this. Many seniors discover their spikes happen at the same time each day, often related to medication timing, meals, fatigue, or stress. Second, review how and when you're measuring your blood pressure. Always measure at the same time each day, ideally in the morning before medications and in the evening before dinner, unless your doctor has instructed otherwise. Sit quietly for 5 minutes first. No caffeine, no exercise, and no emotional conversations beforehand. Consistency matters more than frequency. Third, pay close attention to hydration. Dehydration is a very common and overlooked cause of blood pressure spikes in older adults. When fluid levels drop, blood vessels constrict to maintain circulation, raising pressure. Sip water steadily throughout the day unless you've been given fluid restrictions. Do not wait until you feel thirsty. That signal weakens with age. Fourth, look at sodium exposure honestly. This doesn't just mean the salt shaker. Canned soups, frozen meals, deli meats, sauces, and even bread can quietly push sodium intake too high, triggering spikes later in the day. You don't need perfection, just awareness. Fifth, protect your nervous system. Chronic stress keeps blood pressure unstable. Gentle daily routines like walking, stretching, deep breathing, prayer, meditation, or quiet music tell your body it's safe. These are not luxuries. For seniors, they are preventive medicine. Also, be mindful of news consumption. I've seen blood pressure rise dramatically in patients who watch distressing news for hours. Stay informed, yes, but not overwhelmed. Finally, talk to your doctor if spikes are happening frequently. Medication timing adjustments, not necessarily stronger medication, often make the biggest difference. Sometimes, a dose taken earlier, or split differently, stabilizes blood pressure throughout the day. I want to leave you with this reassurance. A blood pressure spike at home does not mean you are failing, or that something terrible is inevitable. It means your body is asking for attention, not punishment. When you respond with calm breathing, proper posture, and thoughtful follow-up, you are doing exactly what protects your heart and brain. You are not fragile. You are capable, and with the right knowledge, you can handle these moments safely and confidently.